Updating tonight's top stories, a cruise to nowhere back in Singapore ahead of schedule. A passenger tests positive for COVID-19. Passengers on board say they are satisfied with the operator's response. Some say they will definitely go again, despite the danger posed by the coronavirus. But Royal Caribbean has decided to cancel a cruise scheduled to depart tomorrow. Sailings will resume on Monday. And for an expert's take, we are joined now by Dr. Ling Li Min, Infectious Diseases Physician at the Rophi Clinic. Well, Dr. Ling, first up, how would you describe the risks of infection during a cruise? And is testing before a cruise still useful?
Well, I think if we were to go back to a time where the Diamond Princess cruise had the case that was the ship that was anchored in Japan, from there, that was they didn't have any safe measurements in place, and we knew that within the first month of the first case that was diagnosed, there was about 600 over cases being infected. So the risk in a cruise ship that does not have any measures in place, any anti-COVID measures in place, would be high, and that is really because of it's a closed environment and there is crowding. So the risk of COVID transmission would be high if there were no safety measures in place.
And for those who were not in close contact with the confirmed case in this instance, why did the Ministry of Health allow them to go home and back to work or school without undergoing stay-home notice?
Well, I think probably they would have been defined as not close contacts. So usually the people who would be placed on quarantine are those that are close contacts of the presumed confirmed case. And this would be defined as people that have been in contact with the supposed positive case within a meter at least, and would have had some interaction for at least half an hour. So these are defined as close contacts. Anyone else that does not meet these criteria are probably not considered close contacts and would probably be considered safe to return back to the community.
So let's touch on the incubation period for the new coronavirus. I mean, just remind us, it's usually between 5 and 14 days. So does that mean that we are not quite out of the woods yet?
Well, yes. So if this particular case is confirmed, if subsequent testing truly confirms that this is a true positive COVID case, then yes, the median periods of incubation and incubation defined by the time where a person is exposed to the virus to the time that the person develops symptoms, the median as in usually, most commonly, the onset of symptoms would occur within 5 to 6 days of exposure to up to 14 days. Of course, there are some reports that have reported up to 24 days, but overall, we can take it that it's between 5 to 6 to 14 days between exposure to onset of symptoms.
Yeah, Dr. Ling, as an infectious diseases physician, in your opinion, were the trial runs for the cruise to nowhere holidays started too soon?
You know, I think it's hard to say it started too soon. Or the truth is, I guess, we are trying to prepare ourselves in a very graduated, phased approach to reopening. And I think having pilot phases of safe cruising programs are just one of these programs that, in a way, that would allow us to test out certain scenarios, test out the protocols that have been in place, test out the testing policies. I guess it is something that needs to be done if we are going to slowly and eventually move into phase 3.
Thanks very much for your insights. That was Dr. Ling Li Min, Infectious Diseases Physician at the Rophi Clinic.